Our topic for today is sleep hygiene. Thank you very much to all of you who are joining us this afternoon. Some of you, I believe, have joined our earlier series, and others will be joining us for the first time. So we welcome all of you. Now, for those who have issues with the Zoom, you can also join us on Facebook Live, available on our Facebook page, fb.com/SCANKCH, fb.com/SCANKCH. My name is Angelina, and I will be moderating this talk. Now, to begin, let me just run through the process. Now, you won't be able to share your audio or video feed when the speaker is delivering the talk, so as to minimize noise disruption, yeah? However, do post questions for our speaker using the chat box at the bottom of the screen. I will be coordinating these questions with the speaker at the end. So this afternoon, I'm delighted to introduce our speaker, Dr. Chen Yoke Yong, a clinical psychologist who practices in both Borneo Medical Center and Hospital Sentosa in Kuching, as well as lecturing in UNIMAS. I will hand over to Dr. Chen, who will bring us through her presentation. Over to you, Dr. Chen.
Thank you, Angelina. Hello, I'm Dr. Chen. So today I'm going to start my webinars on the topic of sleep hygiene. So in this COVID-19, in this crisis, a lot of the issues being reported by the public is having sleep disturbance. So what are sleep disturbance first? So these included those who have problems to going to bed. They lie on the bed for 5 minutes, 10 minutes, 20 minutes, even half an hour, but still couldn't go back to go to sleep. Or those who have lots of nightmares or frequent wake up in the midnight. So these issues are considered under sleep disturbance. So today we are going to talk about sleep hygiene. And this sleep hygiene is actually some very practical tips that can help you to have a sleep. So now my slide or my webinars will be lots of practical tips for you guys to practice and experiment, you know. So all the tips that I'm going to share later is not suitable for everyone, but we have to experiment it one by one. Okay, let's start. The first one, as we know, we need to make our lifestyle change. So the first thing that we need to do is, number one, stick to a sleep schedule. And this you have to practice for this sleep schedule for at least 7 days to build these habits. So what can you do? Number one, you create a routine sleep pattern of a fixed time to go to bed and wake up in the mornings, even during the weekends or during your day off. And you have to practice this routine for 7 days so that your body get used to this routine. And then the second one is go to bed later or getting up earlier. Because we can't sleep, if our body can't sleep and our body don't want to sleep, it's very hard to force them to sleep. The more that you force yourself to sleep, the more frustrations you are. So why not reduce your sleep time? And then gradually increase your sleeping times. We use our internal time alarm clock to wake us up or to make us sleep. So don't always or frequently look at your clock, because the more that you look at your clock, the more frustrations you are. So it's not helpful. So why we have to do all this schedule, all this like go to reduce your sleeping times, and it has to last for 7 days? It's because we want to have our circadian cycle, the rhythms in our internal process that regulates our sleep wake cycles to really get used to the new norms and other new norms. So this is where we need to practice this for at least 7 days. Okay, so, and beside that, we also need to go to sleep when we feel sleepy. So when you say that, okay, now it's time's up, it's midnight, 12 midnight, I have to go to bed. But you spend hours lying on bed without feeling asleep. It makes you frustrated, it makes you stressed, and you don't want to go to bed. You want to go to bed, but your body wants to go to bed, but your mind doesn't want to go to bed. It makes you more frustrations. Why don't you just wake up and then try again? If you can't stay for 20 minutes or more, get up and do something which is calming and boring. So what is calming and boring? So it's more to like you do something repeatedly. For example, you take a wet cloth and you just clean your tables, or you just reorganize the tables in your bedroom. You just maybe read a very boring book, or listen to very soothing music, or watch a very boring drama. You know, you can do this. And then you can try it for 20 minutes to 30 minutes. And then you put everything off and try again. So this is way that we can somehow practice. Okay, next one. The second one will be avoid caffeine and alcohol later in the day. So caffeine, they possess the tendency of delay the timing of your sleep-wake cycle and disturbs your sleeping patterns, resulting in insomnias. Alcohol, it prevents you to having the kind of deep sleep. Maybe you will think, oh, I drink alcohol, I get tipsy, and then I can fall to sleep. But alcohol is actually dehydrating your body. So your body have not enough water. So somehow you have to wake up in the midnight to either go to the toilet or drink more water. So it doesn't really give you a good quality of sleep if you drink alcohol. So you may ask me, avoid caffeine and alcohol later in the days. How later is it? So 4 hours to 6 hours before you plan to go to bed. Next, after you drink, now eat. Don't eat too late in the evening. Same, average for 4 hours. So why? Why don't eat too late? Number one, if you really eat really heavy meals during the evenings, it interferes the release of human growth hormones and melatonin that facilitates quality sleep at night. And so do not go to bed with full, very full, or completely empty stomach. Because I have a lot of clients and patients come to me telling me that, oh, I don't eat at night. And then they feel hungry. And then they're hungry, then they can't sleep because of hunger. So pointless. So do eat balanced and healthy diet. I think everyone knew it. But how to practice it is during the dinner time, something lighter, not that fatty, not that heavy, something lighter. If you really want something heavier, average 4 hours before. And if you really say that, oh, I have 4 hours before I have dinners, but I still hungry before I go to bed, what else can I eat? Yogurt, healthy cereals, 1 to 2 pieces of crackers, bananas, or chocolate even. But chocolate, there are some tricky part about chocolates. If you eat a whole bar of milk chocolate, and then it is better for you to eat around 70% to 95% dark chocolate. And it's not whole bar. It's a thumb size. Okay? So this is what you can have if you really feel hungry before you go to bed. Okay, next one. We should reduce smoking. You know, smoking, if you go to consult any doctors, they will say to you that it's not good. In terms of sleeping, the same. The nicotine stimulates the senses that disturb your sleep quality. Why? Because it increases your breathing disorders that can lead to reduced sleep. It somehow your lungs and your airways, it the nicotines, it makes you really hard to able to make you sleep better. That's why those who have smoked, those who smoking, they're sometimes snoring in the midnight, and this actually doesn't give them a good sleep quality because the oxygen content, because of the sleep cycles. There's a lot of scientific issues there. So if you tell me, okay, I really can't quit smoking, fine, then 4 to 6 hours before sleep. If you notice my slides since the beginning till now, I make it very consistent. It's 4 to 6 hours for everything before you go to sleep. So please remember these magic numbers, 4 to 6 hours. Okay, so a lot of dark slides. Now we can come to something bright. So besides of sleeping at night, although sleep is in the night times, but our daytime activities, it also will disturb or will have an impact on our sleep quality. So it would suggestible and recommend that you have exposures to daylight. This natural daylight helps to calibrate the body's 24 hours internal clock, which is the circadian clock that I have mentioned before, the sleep-wake clock. Your body, it's like a machine, it's a computer. They are very sensitive. They need to really, your brain here, they needs to really understand, oh, okay, oh, now you have activities, you are active, you are awake. And now, oh, you want to relax, you want to get sleep, you want to rest. So they know here. But during the daytime, you make yourself in a very dark room, you don't do any activities, just lying down, you know? So the brain's confused. Am I in the nighttime or am I in the daytime? So when your brain, when your body is confused, then they don't know when to allow you to release hormones or allow you to go to bed. So we need to make it clear to our brain here. It's like, hey, now I'm active, it's daytime. Okay. Then, hey, now it's nighttime, it's dark, I need to rest. So exposure to that light, the daylight is very important. So, and these theories is actually similar to apply to our regular exercise. So when exercise few times a day, it actually research has shown that it gives a dramatic improvement in your sleep quality. It's not only your hours of sleep, but your sleep qualities. So, but it's a but here, do not do vigorous exercise 4 hours before sleep. If you do vigorous exercise 4 hours before sleep, your brain get active. It's like, oh, this lady, this woman, this man, this guy is doing something very active. No, we have to keep you wake up, you know, awake. So no, so 4 hours before sleep, do not do any vigorous exercise. You may ask me, then what should I do before I go to bed? Any exercise? Yeah, stretching, yeah. Meditations, yoga. Okay, that one we will talk about that later on. And then the recommended regular exercise for everyone is morning walk. And this is suggested even to elderlies. Okay, so these are regular exercise during the daytime routine. And besides, you may ask me, is it possible for us to take a nap? Will nap influence our sleep later? Okay, all have to avoid sleeping during daytime. Okay. Is different. There is difference between nap and sleep. Sleep is a circle. It requires 90 minutes, on average 90 minutes sleep. So you have a different stages that you have to go through from the light sleep to deep sleep to the rapid eye movement sleep. These are one circle, average 90 minutes, and this is sleep. And nap is actually you just close your eyes. Give yourself space and rest. That consider nap. So nap, it have a lot of individual variations here, a lot of individual differences. Some should avoid a daytime nap, and some can have it. And then when, do not more than 30 minutes for adult and not more than 1 hour for child. The suitable, the relevant, or the mostly highly recommended will be 1 p.m. to 3 p.m. within this period of time. And it comes back again to the sleep-wake circle. Because in our sleep-wake circle, there are two intense sleepiness for these 24 hours. One is 1 p.m. to 3 p.m. Another one is 2 a.m. in the morning until 4 a.m. in the morning. So we have to get used, we have to make good use of this nap. So if you are doing some shift work, like a lot of our frontliners, a lot of our volunteers, if you do shift work and so the good rule of thumbs is to take your nap at 6 to 8 hours after you're waking up. If you tell me, like some of you may take nap for more than 1 hour or more than half an hour, especially adults, you will feel like very unpleasant feeling. You may feel very dizzy. Yeah, you are right. Why? Because your body, your brain, your circle is actually trying to enter a deep sleep. But there's a whole sleep cycle, as I explained or described just now, is not complete. So of course, your body, your mind, your brain, they want to protest if you sleep more than that. Okay, so now we come back to nighttime again. Blue light exposure, we have to limit that. We have to reduce that. As this blue light exposure, it impacts again our sleep-wake circle. It somehow, this blue light exposure through our eyes, come through our brain here, it somehow it tricks our brain cells that thinking that is daytime. So our brain get confused again. Is it daytime? Is it nighttime? Is it for activities or is it for sleep? So this blue light, it tricks our brains. So, and this blue light also can increase our breathing disorders that can lead to reduced sleep. So rule of thumb again, 4 to 6 hours before sleep. Next is we have to understand bed. Your lovely bed is for sleeping. Do not use your bed for non-sleep activities, such as watching TVs, reading, paying bills, playing games, So that all is trying to activate or to stimulate your brain cells to think, to make decisions. It reactivates. But your bed is for you to rest. So if we only make our bed for sleeping or for intimacy, other than that, our brain will get a connection. Our mind will build an association that bed is with sleep. So every time when you go onto the bed or you lie on the bed, it's like a cue to your brain saying that, hey, time to sleep. So it's very important. Bed is for sleeping or intimacy. Okay, next, environment. So environment, we have to try to keep our environment clean and tidy. Okay, noise and light is also individual differences. Some they want some white noise. They want some low frequency noise in order to make them sleep. But some not at all. Okay, they are highly sensitive to noises. So they are not good for their sleep when they have a lot of noises around he or her. So, and same to light. Some may want some dim light and some wants completely block off the light. So for those who cannot to tolerance with any noise and sounds and lights, okay, you can use blackout curtains, sleeping masks, earplugs, all this to actually to block off the noise and the light. Of course, your pillows, your bed, your mattress, okay, choose the one that you feel comfortable. And it supports, according to research, it supports the temperature should be 17 degrees Celsius to 23 degrees Celsius. Lower than this, you feel too cold, then you will wake up in the midnight. Above this, you'll feel warm unless you have a different type of blanket. So then you choose the one that you feel most comfortable to you. And this is the part where a lot of people do not notice, which is the sleep rituals. So everyone has to develop their own rituals too. It's a little bit seems like the bed for sleeping. It's like a cue to you that, hey, it's time for you to sleep. So everyone's different. You have to find your own. But I'm trying to give you some example based on my own experience and my client's experience. So some of them, they like to stretching, do meditation. They like to do some breathing exercise. They will go to wash their feet. So after they wash their feet, they will come and then they can sleep. Some like to apply lip balm. So once they apply lip balms, okay, time to sleep. Some will go toilet before they go to sleep and eat and drink a sip of water or get showers or have some music on. So this is a sleep ritual. It's a little bit like habits. You may not notice it, but maybe today, since starting from today, you can start and try to notice what are your habits that like you on to sleep. So, and during this time, try not to engage in very difficult conversations such as learning, working, decision making, problem solving. So this is not a good timing for that. So usually we have this sleep ritual 15 minutes before you go to bed. If you couldn't, you go to bed and then you lie for 20 minutes, you still cannot sleep, then you wake up just now, like I was saying in the first slide, you wake up, you do the things, and then before you go back to sleep again, repeat the sleep rituals. We are trying to develop the associations and the habits. Okay, so deep relaxations. So you have to clear your mind, you have to calm minds. Okay, you can practice what? Meditations, yoga, even yoga, yeah, 4 to 6 hours before sleep. Listen to a relaxing music. So this music, please do choose a specific music. If you like to listen to raindrops, then every time before you go to sleep, choose a similar music. If you like the sounds of rubbing hand, chopping, yes, do choose that one and make it every time, make it become a habit. And so when your body achieves of relaxations and the mind is disengaged with a stressful thinking patterns, the whole body is released into a deeper, more peaceful sleep. With this, there's a lot of, I can share with you with one's relaxation techniques, which is deep breathing exercise. You can find this deep breathing exercise at many YouTube videos. So this is I think I found this is the easiest way for my clients and myself to understand, is you breathe into your nose and breathe out to your mouth. When you breathe in, try to push your muscle out to suck your muscle in. So these are some practice of your relaxations. And this is trying to do a deep breathing exercise to really relax or calm your brain and your body. Okay, so as a conclusion of the tips that I have shared with you regarding sleep hygiene, number one, make your lifestyle change. Avoid smoking, avoid caffeine, avoid alcohol. Do not eat too late. Do not go to bed with empty or full stomach. Get regular exercise. Have your daytime routine. Avoid your blue light exposures. Make bed as only for sleeping, your environment, and your sleep ritual. and also your relaxations. Some may ask me, well, in the middle of night, you suddenly wake up and then you will get panic. You don't know, oh my goodness, I wake up so early. Why? I can't go back to sleep. I knew that. So the first thing that you need to tell yourself, or when you wake up, don't worry, relax. Simply accept that you are awake and don't try to force yourself to fall back to sleep until your body decides to. And then you can wake up. You can try to sleep, but it really cannot. You can wake up, start again, do some very calming and soothing exercise, and then repeat your sleep rituals, and then try to go back to sleep. There are some of you, or those who cannot sleep, they always come to me telling me that in the evening time, I already feel anxious, you know, already have fear of I cannot sleep tonight, you know. So this is what we call anticipatory anxiety towards sleep. So if this have some kind of psychological issues there, then you need to find clinical psychologists, or you need to find doctors, you need to find psychiatrists or counselors to actually really target that issue first. So it will be recommended to you guys, if you really cannot sleep for a long time, please do a sleep assessment so that we know what are the triggers and then we target the triggers. So if maybe it's not regarding all about the sleep hygiene, it's because of your stress. A very quick one is about your sleep cycle that I have mentioned just now. So this is the 5 stages that we have. So stage 1 is drowsiness. Stage 2 is the light sleep. A lot of you who are frequently wake up are always in these 2 stages. They are go and fall. And then deep sleep. Usually deep sleep, if you in one night for 8 hours, if you can have 1 hour to 2 hours of deep sleep, it's already brilliant. And then the next one will be the rapid eyes movement. So this is where we have a lot of dreams. And according to the questions that collected from the host, is as some of you asked me, what is the durations, the normal duration of sleeps? So for every stage of life, we actually, the hours of sleep that needed is different. So babies need 16 hours, and then teenagers 8 to 10, adult 8 hours. And this a lot of difference. Everyone quite different. Average 7 to 9 hours. Okay, I think time's up. I used up 27 minutes. So I'll pass on to Angelina if are there any questions.
Okay, Dr. Chen, thank you so much. I think most of us can relate to what you have said in your presentation. Now we have some more questions here. I'll come to you. Okay, what are your thoughts on sleep chronotypes, especially the work of Dr. Michael Bruce?
Okay, the sleep chronotype is actually the sleep chronotype, there are 4 chronotypes. If I'm not mistaken, there are wolf, bear, lions, and dolphins. So this chronotype is actually more to like categorize people in what their sleeping patterns. So, and then according to it, then what are the advice that we can give? For example, like bear, they have no problem of sleep, though they actually don't need any type of advice. But for dolphin, which is like they don't have a proper sleeping hours, then we all have to come back to the sleep assessments, no matter what chronotype you are, so that we know what is your trigger, what makes you cannot sleep. I think that is more important. I hope I answer your questions.
Yeah, I think probably that was what this person was referring to, the 4 types, yeah? Probably some people are like late risers, some are early risers, yeah?
Yes, like the bear will be the, or bear and lions, they are the morning person, we consider as morning person, and the wolf will be the night person. Okay, regarding the morning person and night person, You can see a lot of our sleep experts, they will say we sleep at night and wake up in the morning time. However, you know, it's still different. It still depends on you, individual difference. If you choose to sleep during daytime and work during nighttime, and it doesn't affect your functioning, your social interactions, fine. No, fine. You just sleep according to American hours. No, nothing wrong. But if you sleep in the daytime and you wake up in the nighttime and you have disturbed your social interaction with others, you're not spending time with your wife or husband, you're not spending time with your children or parents or teachers or friends, then it's not recommended. It will be better if you have like activities during daytime and sleep during nighttime. Thank you.
Okay, next question that we have here is now, any specific minerals or vitamins for a sound sleep? I think somebody has also asked if whether magnesium helps in relaxation to sleep.
I saw some literatures and some posts and some feedback from clients, from the literatures, papers, articles published. They do have some recommendations on magnesium. Magnesium, melatonin, you know. However, it's not suitable for everyone. It's not suitable for everyone. In order to do this, you know, it's like in the beginning, what I mentioned is an experiment. You have to try it on yourself. For somebody, it may tell you, hey, I try on magnesium and it worked for me. You should try it. But the result is not good. Because your body has enough magnesium, doesn't need it. Your sleep disturbance is due to the stress, then it's pointless. So still come back to the sleep assessment that I have mentioned just now. It's still, you need to really know what is your trigger that you couldn't sleep. So still recommended you to do a sleep assessment. If you feel like not the time yet, not ready yet, it's fine. You'll just try out the tips that I have shared with you and experimenting everything. You will find your own. Thank you.
So
hope I answered.
Yeah, it's better to have a assessment first, right? Rather than taking those.
Yeah.
Okay, I think someone's asking now, where do we get this sleep assessment done? Where can it be done?
The neurologist, and okay, so now what I know better is actually at Kuching here. So now I'm telling the Kuching people here, where you can get it is at GH. I think there is one doctors or MAs or MOs, they are doing some kind of sleep studies. So they are experts in this field. And then at BMC that I know that they have the machine to actually, they have the some kind of machine that puts a lot of clot, you know, electric trots on your brain, and then you have to stay overnight to really monitor your breathing, your brain frequency, you know, the amplitudes, all this wavelength in your brain to really know what is your sleep problems. Of course, your sleep assessment you also can find psychiatrists and clinical psychologists to do it.
Okay. Okay, what's another question here? What's your view on the use of hypnosis to tackle sleep problem?
Okay, hypnosis that are used for many different issues, but the hypnosis is actually more to like, the theory behind the hypnosis is somehow, correct me if I'm wrong, I'm not an expert of hypnosis, okay? So if I say anything wrong, please correct me, we learn together. But what I understand about hypnosis is more to like, it gives you a very routine, a very constant of frequency that somehow they drag you from a conscious mind to subconscious and unconscious mind. So when it can go back to your conscious and subconscious mind, it can help you to maybe find out what is your sleep issues, or maybe, you know, it's not, maybe it may not, your sleep disturbance is purely about sleep. It maybe have your past trauma or past experience that have that has been your trigger of your sleep disturbance. So the hypnosis part is actually more to like finding out the triggers. This is what I understand. So I may be wrong. I'm not an expert in hypnosis. So I just tell you according to what I knew. Thank you. But please do update me if any expert here know hypnosis or have tried on hypnosis. Please share with me. I would like to know that too.
Yeah. Probably if any of our participants today in this chat room, if they have any idea, you could share that with us in the chat box.
Yes, please.
Yeah. Okay, what's the cause of recurring bad dreams in sleep? I am an insomniac and I'm lucky if I get by with 4 hours sleep. Is this bad health-wise?
Okay. So one circle, to be easy, I mean, I always advise according to research, a sleep cycle is actually 90 minutes. But I always advise my patients or my clients, each individual, you have to at least 4 hours sleep. If you can have 4 hours sleep, this is a minimum requirement. It can reduce a lot of health issues. Like you asked about the health issues, right? So if you minimum requirement is 4 hours. Of course, if you can have more, the better. But you do mention one is you said that there has a lot of recurrent bad dreams in your sleep. So this is the very pinpoint or entering point actually to know the trigger of your sleep disturbance. So you may need to find a clinical psychologist, even counselors, even a psychiatrist to really target your bad dreams. Because all bad dreams, it may have a theme and you may not know what is that for. Please don't do it yourself. Please don't do it yourself, because you may do it yourself and try to dig and then trying to find out what is my bad dreams theme. And then you find out that, oh my gosh, it's my past trauma. And you open the wound, you don't know how to close the wound, then it may create more issues. So if you really decide you want to know about your bad dreams and you want to make sense of it and gain some insight or awareness, please do it with professionals' help.
Right. The next question here, now, is there anything that we could do to reduce the dreams after we fall asleep for patients who have rapid eye movement sleep disorder? I think this is from a patient who has rapid eye movement sleep disorder.
Okay, for this one, I'm not sure what to try. However, for this one, I have 2 or 3 patients before. One of them, they try yoga. Okay, that one is very good for one of my clients, but it's not good for another one. But and then another 2 is they're trying to do meditations before sleep. Meditations, you can, meditation doesn't mean that you have to sit still and then close your eyes and meditate for 1 hour. No, no. You even can go to YouTube and you'll find a meditation videos for 15 minutes. It could do. This is another one. So basically, what you can do is, before you fall asleep, you have to soothe yourself first. This is very important for the rapid eye movement sleep disorders. They are very active, their brain. That's why I have rapid eye movement disorder, sleep disorder. So you have to tell your nerve, your brain nerve, like, hey, I am relaxed, I am not that active, don't too active. You have to calm down first. So these are some advice that, and also the sleep rituals that I shared just now, it will be very good for you too.
Okay. All right, next question here. You mentioned that morning walk is recommended for all. What about evening walk? Will it still help if done 4 hours before bedtime?
Yes, of course.
So
of
I
course.
think, yeah.
Yeah. 4 hours, if you like 4 hours before sleeping time, you go and try your evening walk. And then that night you see, oh, can I sleep? Have I have a good sleep? If you feel that you don't have a good sleep, okay, then you slightly increase 4.5 hours. And then you slightly, still cannot, then 5 hours. Still cannot 5.5, still cannot 6. And then if you try so many times and still doesn't work, meaning that this doesn't suit you. So actually, sorry that there's one point that I forgot to put in my slide is for those who have a long-term sleep disturbance, it will be good if you have a sleep diary. So like just now the tips I have shared with you, you can try like, oh, this one I tried. You keep a record in it. So you know, oh, okay, this worked for me, this actually worked for me, this actually worked for me. Why does sleep diary become important? Because our mind is quite specially designed. We will sometimes automatically, we are too focused on the day that we cannot sleep, but we tend to ignore the time that we can sleep. So if we have a record, that is more objective.
Okay. I think Chris would like to share something with us. He says that there is an app called Simple Habits for those who want to try meditation. So for this is for information of all, yeah.
Yeah, and then I can. There is one. It's called CBTI. C for cat, B for boy, T for tree, and then I for I love you. Okay, is CBT Insomnia is an app too. It also will help if you need some guidance, in terms of sleeping. Okay, there is an app that you can try, and they have another app is called Smiling Mind. In Smiling Mind, they have a full how to teach you how to relax, how to be mindful in exercising and sleeping. They have like guided voice recorded guided voice there to actually help you to meditate and have sleep better.
Okay. Okay, another question here. How do you diagnose sleep apnea? Which specialist should we see? Probably you could explain what is sleep apnea all about first, Dr. Chen.
Okay, so if you want to, actually, if you can go back to my slide, that's my slide. I have one slide for sleep apnea. So, is my slide on the screen? Okay. Okay, sleep apnea is a sleep disorder characterized by abnormal pauses in breathing or intensities of abnormally low breathing during sleep. So it's very low risk for death. Okay? The percentage, the prevalence is very low to cause death, but it still causes a lot of problems. For example, you have really sleepiness during daytime, and then easily get frustrated, irritable. And then of course you can see there are symptoms for this sleep apnea. And what is the cause of this sleep apnea is actually the muscle in the back of your throat here, the airways. It causes. So this is your airway, and then when you're lying down, so the muscle at your back of your neck and your mouth here, it somehow get really relaxed. When it get really relaxed, it somehow to be like this. When it become like this, it narrow your airways so that it do not have enough oxygen to flow through to your brain. Now, in order to make you sleep better, is actually your brain should have enough oxygen. That's why people yawning before sleep, because they want to get enough oxygen. And also another cause is because brain fails to transmit signal for your breathing muscle. It's also caused by stress, mood disorders, and also other health issues. So for sleep apnea, you still need to sleep. You see, this one, I think you need to see a sleep expert. And you need to see a neurologist. Some of neurologists that do assess that. Okay, and Beside that, I'm not really sure. Yeah, I don't want to give a wrong recommendations. So I'm not really sure. Yeah, I'm very sorry for that.
All right. So probably they can see the neurologist for this as well, right? If those who have experienced this, yeah. I
Yes,
think,
and sleep expert, then the sleep experts.
yeah. Dr. Chen, you mentioned just now about the app. I think could you repeat what was the app that you said that we could use?
CBTI.
CBTI, yeah?
C for cat, B for boy, T for tree, and then I for ice cream. CBT.
Okay.
Another
So,
one is smiling. Smiling, SMILING, space, mind, MIND.
okay. So, Emmy, I think you got that, yeah? Okay. There's an interesting question here, actually. Maybe we can all also, comment to all, some of us. Now, somebody's asking, why is it easier to fall asleep in front of my TV on the sofa than my bed?
This is that's why I said that do some calming and boring thing. When you your TV and in front of your laptops, it's actually the noise. It's the white noise that make you fall asleep. This is one. Second, it probably your TV program is quite boring. Second cause. Third, you associated your sleep with TV program. So that time, with that TV programs on, your button to sleep on in your brain here are pushed on. So then you sleep. So you have to readjust all the sleep rituals. And some, what does not hypnosis also is when you listen to sound like constant, this sound or this movement, you are very easy to sleep. If you want to know more why, okay, this a lot of to do with our neural. Okay, so it makes your neural tired, so you easily to fall asleep. So make it simple as this.
Okay.
Hope I do answer your questions.
Yeah, I presume that answers everybody's the question for this. Yeah. Okay. We still have some more time. Do you have any more questions? Anybody has any more questions to ask? You can type it on the chat box, or maybe Dr. Chen, you would like to share anything else with us? Anything extra?
I actually have the testing here that I try to come out, and these are, you see a lot of all these things is actually what we call the neural imaging. Okay, and this neural imaging is actually to measure our sleep wavelength, our brain wavelength, to really know what like the stages that I share with you, the 5 stages or 6 stages too. So with this wavelength, scientists or sleep experts, they are able to read your wavelength and then they know which stage you are in. So these are one of the sleep assessment that I mentioned. Okay.
Right. There's another question coming in here now. Melatonin.
Yeah.
Asking melatonin. When can we take it?
When can we okay, this one, because I'm a clinical psychologist, I'm not really sure about the prescriptions, but what I understand, melatonin, you have to, so I really could not answer these questions. You have to really ask your pharmacist or your doctors. However, in order to take your melatonin, there are some precautions that you need to take. For example, if you have psychological issues, you are taking some antidepressant medicines, and if you eat with melatonin, it actually weakens the melatonin's impact. If you have high blood or high pressures, there are certain types of medicines you take to target your high blood pressure. It actually will weaken your melatonin too. So there are a lot of precautions that you have to take. And I'm not the best person who answer this. I think pharmacists or doctors will be the best person to answer this. I'm very sorry for that.
Yeah, so I presume that this should be taken under doctor's advice then.
Yes, yes, yes.
Okay.
There are studies and meta-analysis, a lot of literature show that it do give an impact to sleep disturbance. However, like what Angelina was saying, please consult your doctor or pharmacist.
Okay. So do we have any more questions from the group? Okay. No more questions?
Yep.
Yeah, I think Dayang is saying that the melatonin is normally given for long flights. So yeah, I presume that's what they use it for. She's saying that melatonin given for long flights.
For normal, I mean public without any health issues, if you take melatonin, it gives you an impact, a good impact in your sleep. Again, we don't know your physical issues, so I cannot like tell you should take it or you should not take it and how much you should take it.
Yeah, I presume some people take it so that they can sleep on the flights probably, but then again, it's best to consult a doctor, not just take it.
Yes. Yes.
Okay. So I don't think there's any more questions.
Good.
All right. So you have made yourself clear.
Oh, I think there's one more. How to
encourage
teenagers and adult children.
Yeah, how to encourage teenage and adult children to sleep early. Most of them sleep after midnight.
Especially now, they don't need to go to school. So there's pointless. There is no reason for them to wake up early. But it's quite hard. It's actually quite hard to encourage them to sleep early. One of it is you need to cultivate early sleep habits since young. So if you do that when they are still young, then I think is easier for parents to actually to monitor their sleep patterns or their sleeping time. However, for our teenagers and adolescents now, they have more friends at nighttime. They're more active at night times. And a lot of them are playing games, and all the live videos games from Americas or Germany, they have live videos in the midnight. So it's very hard to ask them to really sleep early. And how early you mentioned here. So this is the norms that we have. But if you really want them to sleep early, ABA, Applied Behavior Analysis. This is one of our clinical psychologist assessment or interventions. It could be applied to them. So what is ABA? So it's more to like the reward punish system. So if you sleep early, what are the rewards that you can give? If they sleep very late, what are the punishment that you can give? In order to change someone's behaviors, only two ways: reward, punish. Like what I say in the sessions is, if their late sleep do not have an impact on their social interactions, in their health, on their health, personally, I think it's fine. But this is only my personal view. I don't think lots of parents will agree with me. However, for most of the teenagers and children, they need to have some kind of interactions during daytime. So at least, what we can do or advise them is we need to know why they don't sleep, so we can target the trigger. Second, we gradually increase their sleeping time. For example, they go to sleep by 2 o'clock in the morning and they wake up 12 noon. I don't think that is, then we have to reduce their waking time. So we wake them up at 8 o'clock, 7 o'clock. So that definitely they have no enough sleep. During evening time, they're already very sleepy. Do not allow them to go to sleep. I'm strongly not recommend to compensate sleep. Then at nighttime, they themselves feel sleepy. Body tell them sleepy. Then they will go back to sleep earlier. Let their body tell them, not parents.
Yes, I guess this is a common thing for parents experience.
Yeah, it's quite hard. It's a big headache.
Okay.
Okay.
So we don't have any more questions. Bridget, that was the last question. So, okay, now thank you, Dr. Chen, for this very informative session. I think we can all relate to what you have said. Now, for those of you who have further questions to ask, you may forward the questions to Scan at webinar, WEBINAR, webinar at scan.org.my, yeah, which is also shown on the screen. Yeah. And we will forward this to Dr. Chen for
yes.
her answer. We would also appreciate if you would also give us some feedback for further improvement or on topics you would want us to discuss in our further webinars. And you can also check our Facebook and YouTube channels to see our past webinars. We will also be uploading today's session on our YouTube channel in a day or two. Now do watch this space for more of our upcoming webinar series. Now, thank you once again, Dr. Chen, for
thank you.
Today.
Thank you, Dr. Chen.
Thank you.
Now until our next webinar then. Good evening. Bye.
Thank you. Thank you very much. Bye-bye.
Bye-bye.